And welcome to the programme. Coming up this Tuesday evening, months of misery why this woman from Cheltenham thinks Covid-19 is to blame for her chronic health issues.
My ears aren't working. The worst thing for me is my eyesight. I've lost so much of it and I'm terrified I won't get it back.
Also on the programme, the hospital that didn't treat any patients. The NHS's multi-million-pound Nightingale in Bristol is officially stood down after 9 weeks. Plus, coastlines paying the price with demand for single-use plastics rising post-Covid. Campaigners warn we mustn't forget about the environmental crisis. And it's a sea of purple as this West Country couple harvest their first crop of the year. Good evening. A Gloucestershire woman has told ITV News she has been left living with terrible long-term effects caused by Covid-19. Nic Mitchell from Cheltenham has never tested positive for the virus as she developed symptoms back in December when the disease was only just emerging. But she is part of an increasingly large number of people plagued with chronic and debilitating conditions who say the virus is to blame. Ken Goodwin has this report.
Nic Mitchell thinks she caught Covid-19 at Gatwick Airport en route to St Lucia in the Caribbean in December. It was meant to be a restful holiday, but while she was there she developed what we now know as classic symptoms of the coronavirus.
At that point, I'd been told, people on holiday, that I had swine flu because it was the only thing they knew of, and the doctor accepted that as fact because I was showing a very big inflammatory reaction to the virus.
At home in Cheltenham, her condition worsened. Nic developed a cocktail of symptoms, some of which are now slowly being recognised as possible long-term effects of Covid-19.
Well, you can see I've got arthritic gloves on and I get tremors. I've got such weakness in my hands. It's very difficult to hold things. The same with my feet. Taste is gone, smell's gone, my ears aren't working. The worst thing for me is my eyesight. I've lost so much of it and I'm terrified I won't get it back.
And memory?
I think that one's the worst because I'm normally really academic and bright and I have to think about the words before I even put them out. I forget how many times I've fed my dogs, which is probably good for them, but taking my tablets, I'm on 6 different medications and I just can't remember which ones I've taken or how many I've taken.
She says the symptoms she is showing tie in with thousands of other people who are reporting the after effects of coronavirus, the so-called long haulers.
I mean, the research is showing almost 30% of people that have had COVID will go on to be a long hauler, just like me. And whilst I'm on month 6 of it, so many people online, there's 20,000 people in the UK group that have got this. There are hundreds of thousands in the US groups, and there's groups in Italy, Germany, South Korea. It's a blessing because you have somebody to talk to, but it is also horribly annoying and frustrating because you hear these people in these dire circumstances, particularly those trying to look after children. None of us can work, a lot of us are on benefits, and it's that inability to do something, and that's why I've been studying, because I'm so desperate to find things to cure. I found little things to make symptoms better, but it's a virus, it doesn't respond to much.
She wants the government to provide more support for long haulers, many of whom cannot work because of chronic fatigue.
It's made me question everything, whether I can fight it every day, some days I want to kick it like it's a person, I want to fight it. Other days I just want to give up and sleep all day. There are days where I just don't move, I don't get out of bed, I just don't have the energy to do it.
In the early days of Covid-19, it was assumed the majority of people would recover in the same way that they do from flu. But this coronavirus is proving to be more tricky, and there may be thousands of people who think they are over the worst, but may be in it for the long haul. Ken Goodwin, ITV News, Cheltenham.
Well, let's get some more on this from the TV medic, Dr. Dawn Harper. Dawn, thanks for coming on the programme. We've just been hearing about some of the possible longer-term effects of coronavirus, but I guess this is something that we're only really just starting to find out more about.
Yes, I mean, this coronavirus, we didn't know about at the beginning of the year, so we are all on a steep learning curve, and increasingly we are aware of a significant cohort of patients who perhaps weren't that unwell with the infection itself. So not necessarily people who are hospitalised or in intensive care, but people who had symptoms but just haven't recovered and then have developed all sorts of different symptoms that we are having to learn about. Difficulties with concentration, perhaps visual problems which they've never had before, skin rashes, joint pains, you name it. We're hearing about this increasingly, and we are having to, if you like, put the pieces of the jigsaw together to try and understand a bit more about the long-term effects of this infection.
And just how challenging is that? It actually seems quite surprising that some of these people who are being worst affected further down the line might not have been hospitalised or even known that they had coronavirus.
It's a huge challenge, John T, because we are looking at often lots of symptoms affecting different parts of the body, and of course, understandably, in the early stages, our focus was very much on the death rate and those people in intensive care. But as we are seeing a flattening of the curve and we are going through this pandemic, we are seeing more and more people with long-term effects. And there is this kind of post-infective syndrome that we're seeing, but also in general practice, I'm very aware that we're going to see a lot of people, for example, with long-term kidney problems, maybe long-term breathing problems, maybe the after effects of blood clots and so on. So this is going to be a massive challenge for a long, long while in general practice.
And so, Dawn, as a medical professional yourself, we know that the NHS has been given extra funding, extra support to cope with the immediate threat of coronavirus, but the longer-term impact, that must be worrying as well.
It's a huge worry to us in general practice. I completely understand why the focus of funding has been on the acute. That's completely understandable and the correct thing to do. But we are mindful that going forward, there will be a lot of people who have long-term effects of this infection that could impact on them as individuals and on us in the NHS in primary care for decades to come.
Dr. Dawn Harper, we'll have to leave it there. Thanks so much for coming on the programme.
Thank you.